Human metapneumovirus, or HMPV, is a respiratory virus that was first discovered in 2001. It is a relatively new virus, but it has quickly become one of the most common causes of respiratory infections worldwide. HMPV is a member of the Pneumoviridae family, which also includes respiratory syncytial virus, or RSV. HMPV is thought to have originated in birds, but it has since jumped to humans. The virus is spread through respiratory droplets, which are released when an infected person coughs or sneezes. HMPV can also be spread through contact with contaminated surfaces. The virus was first identified in the Netherlands, but it has since been found in countries all over the world. HMPV is a seasonal virus, and it is most common in the winter and spring months. The virus can infect people of all ages, but it is most likely to cause severe illness in young children, older adults, and people with weakened immune systems. There is currently no vaccine or specific antiviral treatment for HMPV infection. HMPV infection is caused by the human metapneumovirus. This virus spreads primarily through close contact with an infected individual. When an infected person coughs or sneezes, tiny droplets containing the virus are released into the air. These droplets can then be inhaled by others nearby, leading to infection. In addition to the respiratory droplets, HMPV can also spread through contact with contaminated surfaces. For instance, if an infected person touches their nose or mouth and then touches a surface, the virus can be deposited on that surface. If another person then touches that same surface and then touches their own nose or mouth, they can become infected. The virus enters the body through the nose or mouth and travels to the respiratory tract. Once in the respiratory tract, the virus attaches to and infects cells lining the airways, leading to inflammation and irritation. Factors that increase the risk of HMPV infection include close contact with infected individuals, particularly young children, exposure to crowded environments such as daycare centers and schools, and a weakened immune system. HMPV infection can cause a wide range of symptoms, from mild cold-like symptoms to severe respiratory illness. The severity of symptoms can vary depending on several factors, including the individual's age, overall health, and immune system strength. Early symptoms of HMPV infection often resemble those of the common cold. These may include a runny nose, nasal congestion, cough, sore throat, and low-grade fever. Infected individuals may also experience sneezing, headache, and fatigue. In some cases, HMPV infection can progress to more serious respiratory illnesses such as bronchiolitis or pneumonia. Bronchiolitis is an inflammation of the small airways in the lungs, known as bronchioles. Symptoms of bronchiolitis may include wheezing, rapid breathing, difficulty breathing, chest pain, and a persistent cough. Pneumonia, an infection of the lungs, can cause high fever, chills, chest pain, shortness of breath, and a cough that produces phlegm. Preventing HMPV infection involves adopting several hygiene practices and lifestyle modifications. These measures aim to reduce the risk of exposure to the virus and strengthen the body's natural defenses. One of the most effective ways to prevent HMPV infection is to practice good hand hygiene. This includes washing hands frequently with soap and water for at least 20 seconds, especially after coughing, sneezing, or being in public places. If soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol can be used. Covering coughs and sneezes is crucial in preventing the spread of respiratory droplets. When coughing or sneezing, individuals should cover their mouth and nose with a tissue or the crook of their elbow. Used tissues should be disposed of properly, and hands should be washed thoroughly afterwards. Avoiding close contact with sick individuals is another important preventive measure. This includes maintaining a safe distance from people who are coughing or sneezing and avoiding sharing personal items such as utensils, drinking glasses, and towels. Section 5. Age groups most affected by HMPV. HMPV can infect individuals of all ages, but certain age groups are more susceptible to developing severe complications from the virus. Young children, especially infants under 6 months of age, are particularly vulnerable to HMPV infection. Their immune systems are still developing, making them more susceptible to respiratory infections. Infants infected with HMPV may experience bronchiolitis, pneumonia, and respiratory failure, requiring hospitalization. Older adults, particularly those over 65 years of age are also at increased risk of severe HMPV infection. As individuals age, their immune systems naturally weaken, making them more vulnerable to infections. Underlying health conditions common in older adults, such as heart disease, lung disease, and diabetes, can further increase the risk of complications. Individuals with weakened immune systems, regardless of age, are also at increased risk of severe HMPV infection. This includes people with HIV/AIDS, cancer patients undergoing chemotherapy, and organ transplant recipients. Section 6. Global impact of HMPV in 2025. As of 2025, HMPV continues to pose a significant public health challenge globally, impacting countries across different continents. The virus's widespread prevalence and potential for severe complications, particularly in vulnerable populations, underscore the need for continued surveillance, research, and public health interventions. In North America, the United States and Canada have reported a surge in HMPV cases in recent years. The virus has placed a strain on healthcare systems, particularly pediatric intensive care units during peak seasons. European countries have also experienced a rise in HMPV infections, with outbreaks reported in the United Kingdom, France, Germany, and Italy. The virus's impact has been felt across age groups, with hospitalizations reported in both young children and older adults. In Asia, countries such as China, Japan, and South Korea have reported a significant burden of HMPV disease. Rapid urbanization, increased international travel, and aging populations contribute to the virus's spread and impact. Section 7. HMPV in Nepal, an analysis. Nepal, a landlocked country in South Asia, faces unique challenges in addressing the burden of HMPV infection. The country's mountainous terrain, limited healthcare infrastructure, and socio-economic disparities contribute to the spread and impact of respiratory infections. HMPV has been identified as a significant cause of respiratory illness in Nepal, particularly among young children. A study conducted in rural Nepal found that HMPV was responsible for a substantial proportion of hospitalizations due to acute respiratory infections in children under 5 years of age. The country's limited access to healthcare facilities, particularly in remote areas, poses a significant challenge in diagnosing and treating HMPV infection. Many communities lack access to basic healthcare services, including laboratory testing for respiratory viruses. Nepal's climate, characterized by distinct seasons, also plays a role in the spread of HMPV. The virus is most prevalent during the winter and spring months, when temperatures are colder, and people tend to congregate indoors, increasing the risk of transmission. Section 8. Insights from virologists. Virologists, experts in the study of viruses, play a crucial role in understanding HMPV, its transmission, and the development of potential treatments and vaccines. Their research provides valuable insights into the virus's biology, epidemiology, and clinical manifestations. According to leading virologists, HMPV is a highly contagious virus that can spread rapidly through populations. Its ability to mutate and evolve over time poses challenges for vaccine development. Researchers are actively investigating the genetic makeup of HMPV to identify potential targets for antiviral drugs. Understanding the virus's replication cycle and how it interacts with the human immune system is crucial for developing effective treatments. Virologists emphasize the importance of continuous surveillance of HMPV to monitor its circulation patterns, identify new strains, and assess the effectiveness of preventive measures. By tracking the virus's evolution, researchers can adapt vaccines and treatment strategies as needed. Section 9. Combating HMPV, solutions and preventive measures. Addressing the global burden of HMPV requires a multifaceted approach involving public health interventions, research and development efforts, and individual actions. Public health authorities play a crucial role in raising awareness about HMPV, promoting preventive measures, and implementing surveillance systems to track the virus's spread. Educational campaigns can target healthcare providers, parents, and the general public, providing information about the virus, its transmission, and ways to reduce the risk of infection. Research and development efforts are essential for developing effective vaccines and antiviral treatments for HMPV. Vaccines that target the virus's surface proteins, which are involved in attachment and entry into host cells, hold promise for preventing infection. Individuals can take proactive steps to protect themselves and others from HMPV infection. Practicing good hand hygiene, covering coughs and sneezes, and avoiding close contact with sick individuals are simple yet effective ways to reduce the risk of transmission. Section 10. Stay safe, stay healthy. As we navigate the challenges posed by HMPV and other respiratory viruses, it is crucial to prioritize our health and well-being. By adopting preventive measures, staying informed, and seeking prompt medical attention when needed, we can mitigate the impact of these viruses on our lives. Remember to wash your hands frequently, cover your coughs and sneezes, and stay home when you are feeling unwell. If you experience any severe symptoms, such as difficulty breathing, high fever, or chest pain, seek medical attention immediately. By working together and prioritizing our health, we can create a safer and healthier future for all. Stay informed, stay vigilant, and stay healthy.